Conjunctivitis, pink eye. What is conjunctivitis, pink eye? Conjunctivitis, more commonly known as pink eye, is an inflammation of the conjunctiva, a clear membrane that covers the outermost layer of the eye and the inner surface of the eyelids. As with many of the more common eye inflammations, conjunctivitis usually looks and feels worse than it is, and while the pronounced redness can be quite alarming at first glance, conjunctivitis very rarely causes long-term visual damage. It is, however, a condition that often needs to be diagnosed and treated early, as certain types of conjunctivitis are very contagious and any prolonged inflammation of the eyes should be treated with caution to prevent complications and tissue damage. What are the symptoms of conjunctivitis, pink eye? Conjunctivitis is diagnosed with a straightforward eye examination using a slit lamp, a microscope with a light attached that has been specifically designed for eye examinations. Your doctor or optometrist will examine your eye and ask you about all your symptoms in order to rule out other inflammatory eye conditions and diseases that can mimic symptoms of pink eye. What are the symptoms of conjunctivitis? Pink eye is caused by infections, from bacteria or viruses, allergies, or certain irritants that come into contact with the eye. Thus, the different types of conjunctivitis tend to cause different symptoms. Symptoms of pink eye may include: infection usually begins with one eye, but can quickly spread to other eye in cases of viral or bacterial conjunctivitis. In most cases of pink eye, pain, photophobia and blurred vision are not very common, and should they occur, it is important to seek medical attention to rule out other diseases such as glaucoma, uveitis, keratitis or even meningitis. What causes conjunctivitis, pink eye? Conjunctivitis is most commonly caused by allergies, but can also be caused by certain viruses, bacteria and eye irritants. Common causes of conjunctivitis: allergic conjunctivitis, commonly occurring in people who suffer from an allergic condition. Allergic conjunctivitis can be caused by a number of substances particular to the individual. Other common allergens are dust, pollen, cosmetics, perfume, or medication. Allergic symptoms of pink eye often affects both eyes, and severe itchiness and swelling are common. Viral conjunctivitis. As the name suggests, viral conjunctivitis is caused by a virus, either contracted through the air or direct contact. Viruses that cause the common cold, acute respiratory infections, or disease such as measles or herpes are often the causes of viral conjunctivitis. A herpes infection is actually quite common, especially the herpes simplex virus, which causes cold sores on the lips and mouth area. Exposure to sun and high fevers are triggers for causing these cold sores. For this reason, it is fairly common to notice other symptoms, such as body aches and upper respiratory symptoms, with this type of conjunctivitis, and it is fairly contagious. Bacterial conjunctivitis. Bacteria such as Staphylococcus, Streptococcus, and Haemophilus are the common culprits that cause this type of conjunctivitis, which is highly contagious and easily spread, especially amongst children. Irritant and chemical conjunctivitis. Certain irritants to the eye such as flame burns, some plant saps, irritant gases or chemicals, and environmental toxins can all cause irritant conjunctivitis. Help for conjunctivitis, pink eye. The treatment of conjunctivitis depends on the symptoms of pink eye and what caused the condition. While some cases of conjunctivitis disappear without treatment, or are adequately healed with home care methods, others tend to be more severe and may require more specific diagnosis and treatment. Home care. Saline eye drops can be used to soothe the discomfort of conjunctivitis, as will a warm cloth held over the eyelid. In the case of allergic conjunctivitis, it is important to find and remove or distance yourself from the source of the allergy, and you should try not to touch or rub the eyes. A cold compress will ease itchiness and provide some relief. It is also a good idea to use an eye wash, using purified water, regularly throughout the day to speed up recovery. However, Make sure that it is well sterilized beforehand, and if both eyes are infected, a separate eye washer should be used for each eye, or it should be re-sterilized between each use. Using warm milk and honey to treat conjunctivitis, pink eye. Honey has amazing antibacterial properties. Making an eye wash with warm milk and honey can help to soothe and treat conjunctivitis. Use equal parts of both honey and milk, making sure the milk is warm, not boiling. Mix together the remedy and keep stirring until the honey becomes smooth in the milk. Use an eyedropper and drop 2-3 drops into your eye several times a day. Alternatively, you can use this mixture as a compress. The antibacterial properties in the honey and the soothing effects of the milk will start to work immediately, and within 24 hours your pink eye should be cleared up. Tips for treating conjunctivitis. In addition, there are a few natural ways to help provide relief and promote faster healing without any unwanted side effects. Grate a potato and place on the affected eye for 15 minutes. Potato is a natural astringent and will help reduce eye inflammation. Replace the water of your eye wash or compress with warm milk.